For maintenance therapy, my understanding of the updated NCCN guidelines is that oral azacitidine or Onureg is now expanded to include not just patients who are intermediate or adverse risk who have finished consolidation who are not able to go on to transplant, but also for the favorable risk patients who are not core binding factor. The data is taken from the original QUAZAR study, and it's a small subset of patients. So I think that it depends on the specific patient and whether or not that patient would benefit or not. And so I think from that standpoint, it really has to be tailored to what that patient's, both short-term and long-term goals are, how many cycles of consolidation they were able to receive. So I think there's a bunch of factors that go into that decision. It's nice that that is an option if it makes sense for that patient.